Hello everyone. In this video, we'll see the important points for the day 2 of our 15 days timetable. So day 2 of our timetable, it is a 6-hour timetable. We have these topics allotted for day 2, which includes impression procedures from prosthodontics under complete denture, border molding and posterior palatal seal from CD, principles of tooth preparation from FPD prostho, then NSAIDs from pharmacology, local anesthesia from pharmacology as well as oral surgery point of view, antibiotics from pharmacology. So under impression procedure, you should make sure you have gone through the anatomical landmarks of both maxilla and mandible, the stress bearing area and relieving area of that, then Atwood classification of ridge resorption, coronomaxillary space and mesenteric notch, which comes under the anatomical landmarks itself, then buccinator mechanism, a retromolar pad. Retromolar pad is very important. You should know the contents of retromolar pad and the functions of each. Then frenum, all the maxillary and the mandibular frenum, the muscle attachment in the maxillary frenum is very important, especially the labial frenum. Then the composition of alginate and agar, the composition and the function of them, what function it provides for the impression material, and then about the elastomeric impression material, the basic properties of them, some hydrophilic, hydrophobic properties of each of them. Then lastly, the impression techniques. So these are the must know points whenever you are practicing the MCQ from the impression procedures topic. Make sure the MCQs covers these points as well. The next topic is border molding and posterior palatal seal. So under that, what is a posterior palatal seal? The anterior vibrating line and posterior vibrating line, the two parts of the posterior palatal seal. The vibrating line is a junction between what part of the palate is very important, whether it is a movable part or an immovable part, it is a hard palate or soft palate, that you should know. Then what is a fluid wax technique, the head position for fluid wax technique you should know. Then lastly, a little bit about pterygomandibular raphe. The raphe attachment, origin and insertion of the pterygomandibular raphe is important. Next topic is principles of tooth preparation. This is from FPD point of view. So under that, you should mainly know about what is an anti-slaw and the periodontal surface area of the tooth, what is it for you don't need to learn the complete table for all the tooth, but at least for the maxillary molar and the mandibular molar, or which tooth has the highest surface and which tooth has the lowest surface, all those things you should know. Then the degree of tooth taper. Under degree of tooth taper also you should know the optimal tooth taper which is required for the proper retention. Then what is a functional cusp and what is a non-functional cusp and what is a functional cusp bevel. And you should know for maxillary first molar where you give the functional cusp bevel, and for mandibular molar where you give the functional cusp bevel, that is very important. Then about crown root ratio, the components of FPD and the functions of each and every components. Then the types of abutment, what is a cantilever abutment, what is a pier abutment, and what is a tilted abutment, and what type of component of FPD you will modify to accommodate a tilted abutment. Then what is an extensively damaged abutment and how do you tackle them. This is mentioned little bit in the principles of tooth preparation itself, so make sure you cover all these points. Next topic is NSAID. So under NSAID, the classification of NSAID, the COX-2 inhibitor, selective and the non-selective, what is the difference between them? The arachidonic acid pathway, then adverse effect of aspirin, why it should be stopped to avoid any bleeding procedure. So what is the correlation between the aspirin and the platelet mechanism? How does it have an antiplatelet effect? So you should know the concept behind that. Then paracetamol, the adverse effect of paracetamol, then what is a Ray's syndrome, then what drug you give for an acute paracetamol poisoning. So these are the points you should cover from NSAIDs. And the next topic is local anesthesia. So under local anesthesia, you should mainly know the classification of local anesthesia, the mechanism of action of LA, what is the composition of EMLA, then the LA calculation. So whenever you give vasoconstrictor with different ratio of vasoconstrictor, the calculation of LA, that 1 ml of LA, how many grams of local anesthesia and how much amount of vasoconstriction will be there, that will differ. So you should know how do you calculate them. Then the adverse effects of LA and what are the different blocks and infiltration we give in oral cavity. Especially you should know about the INB. And lastly, the antibiotics topic. So under antibiotic, you should know about the classification, the mechanism of antibiotic, what is Jarisch-Alzheimer reaction, aminoglycoside toxicity, what are the adverse effect of chloramphenicol, tetracycline, and what is an acticide, what is atridox, then anti-tubercular drug and adverse effects. Very important, ATT's adverse effect is very important. Then lastly, antiviral. Under antiviral, you should read about the antiretroviral drugs and antifungal drugs. A detailed explanation is there in 2 of our other videos, the antibiotics in oral medicine and the infection topic. So under infection, I've covered little bit about the antiviral drugs as well. So make sure you go through them if you want any explanation. But when you complete the antibiotic topic, definitely 2 or 3 questions will come from antibiotics. So along with the antibiotics, read the adverse effects of them. Thank you all.